Hello, and thank you for tuning in. My name is Temiloluwa Prioleau, and today I will be presenting to you our paper, Understanding Reflection Needs for Personal Health Data in Diabetes. This work is being presented at PervasiveHealth 2020. The key motivation for this work is the prevalence of wearable devices in today's society, more specifically also in health, and the use of such data to inform healthcare. More specifically, continuous glucose monitors, for example, are a wearable medical device that has transformed the standard of care in diabetes management. However, a key barrier to optimal use of CGM data relates to limitations of data delivery and reporting tools for effective interpretation. So in this work, we focused on two research questions. One included a needs assessment survey to understand what users desire in decision support tools that help them better reflect on personal health data from CGMs. Additionally, we developed an alternative visualization tool, and then we also evaluated the effectiveness in enabling users to easily recognize temporal patterns over CGM data, short and long-term periods of CGM data. In this study, in total, we leveraged 20 subjects, which included patients with diabetes, clinicians, as well as caregivers. Specifically from the needs assessment survey, we asked two questions. The first one relates to when users reflect on previous management, what are the key items that they look for? And we identified 5 key variables that users are interested in their previous management. Also, we wanted to understand what do users wish existed in decision support tools that would help them with their reflection on previous CGM data. And we identified that users wish there were solutions that automatically extract patterns, detect changes in management, and suggest actionable items. They also desire tools that integrate data from various relevant sources. With this in mind, we developed a visualization method for presenting CGM data. This was developed in phase 1. It was evaluated, we got feedback, and from that we improved the visualization, and this was developed in phase 2 of that and also evaluated. For example, one of the questions we asked users is to take a minute to study the proposed visualization. What insights can you draw about the user's diabetes management? From this, 85% of subjects identified the most prominent insight, which is positive from our perspective. For example, subject 8, who was a patient, said that from the single week CGM, it looks like perhaps weekend insulin rates / management could be adjusted, and the user should look at changing the overnight basal rates to avoid sleeping low or having low blood glucose during the nights. This was positive from our perspective because the user was able to identify patterns of good and poor management, as well as pinpoint behaviors that lead to management gaps. So with that, just to present some insights, some key insights that we identified for designing decision support tools include visualizations that, or visualizations should include complementary text to help users easily assimilate the information. They should be concise and flexible, contextually fitting, informative, and actionable. Looking forward, how we used to leverage this insights from this is we want to develop an algorithm for automatically extracting patterns from long-term diabetes data. We also want to develop an interactive pyramid structure visualization for diabetes management. So with that, I say thank you for listening. For more details on this work, please do reference our paper, Understanding Reflection Needs for Personal Health Data in Diabetes. And feel free to contact me personally. My email address is here as well as my website. Thank you so much.